Hello friends, good evening everybody. Today I am invited to talk something on glaucoma. But before I talk on glaucoma, I should know or we should all know that why glaucoma is given so much of importance. See, glaucoma is the second leading cause of blindness in India, and this blindness is irreversible blindness. About 80 million people all over the world are affected by glaucoma. And in India, there are about 12 to 14 million people. And this is what you are seeing is only the tip of the iceberg. And 90% unfortunately are still undiagnosed. So early detection and management of glaucoma is very important. Now we'll see what is glaucoma. See, when you are seeing a certain object, the lights fall upon your eyes. And when the lights fall, they go into your retina. And in the retina, there are ganglion cells which then transmit these images to the nerve fibers. The nerve fibers form a cable-like network forming the optic nerve. Once the optic nerve is formed, it transmits these messages to the brain. And these messages in the brain are converted into images and then we see an object. But in glaucoma, because of the rise of intraocular pressure, or there's some other cause, even normal pressures in some eyes, the nerve fiber layers, the ganglion cells, the optic nerve, they start getting damaged. And what happens? The visual fields start constricting. Once the visual fields start constricting, the patient is unaware. But the negative part or the pathetic part of glaucoma is that vision is only affected in advanced stages. So many times in India, we see these patients of advanced glaucoma rather than seeing them early. So we should be able to diagnose and treat glaucoma at early stage to prevent blindness. Now, what are the risk factors? Who can get glaucoma? I, you, him, or who else here? See, major risk factors is the age. As the age advances, the chances of getting glaucoma also increases. Family history, 30% of the patients having family history get glaucoma. Then comes the thin corneas. Patients with high refractive errors. What I mean to say is high plus lenses, high minus lenses. Patients put on steroids. Patients having thin corneas. Patients having trauma to the eye. These all our patients are susceptible to get glaucoma. So, after that, we should know what are types of glaucomas. See, basically there are two types of glaucoma. One is called as the open angle glaucoma and the second one is called as a narrow angle or a closed angle glaucoma. Now, if you see the structure of the eye, there is a colored curtain in the eye that is known as the iris. In the iris, behind when it comes in contact with the sclera or the outer coat of the eye, it forms an angle. This angle contains a filtering meshwork known as the trabecular meshwork, which causes filtration. And behind the iris is a body known as the ciliary body. The function of the ciliary body is to produce an aqueous, and this aqueous drains through the pupil, goes into the filtering meshwork and then through the blood. But with open angle glaucoma, the potential of filtration is reduced by the trabecular meshwork. And so the fluid accumulates in the eye and intraocular pressure is increased. This is open angle. What about closed angle? In closed angle, the iris comes in contact with the trabecular meshwork and closes it initially. Later on, this gets damaged and pressure rises. This is closed angle glaucoma. We also get certain, don't be surprised if I say a newborn baby is also getting glaucoma. 1 in 10,000 chances are there that a small newborn neonatal glaucoma is also present. And it is always not necessary that intraocular pressure should be raised. There are many cases, 30% of the cases have normal tension glaucoma. That means where the pressures are normal, but the patient's optic nerve is getting damaged. This is normal tension glaucoma. Then there are other causes also, patient on steroids, patient who get trauma, patients who take some medications, they all can get glaucoma, but mainly the open angle and the closed angle. So how do we diagnose glaucoma? Mainly and foremost, to diagnose glaucoma, you should have a comprehensive eye checkup from a classified or qualified ophthalmologist. What do you mean by comprehensive eye checkup? Patient under should go, one is the visual acuity, patient under should go refractive error corrections, patient should have their eyes angle checked by gonioscopic lens special, they should measure the corneal thickness by the central corneal, by the pachymetry, they should have the optic nerve, which is the main, by stereoscopic examination, photography of the optic nerve. Then the field, visual field is the most important where the glaucoma is mainly managed. So visual fields on the perimeter, and lastly in OCT, which is a newly diagnostic tool, OCT where nerve fiber layer analysis and optic nerve head analysis is done. So patient has to undergo a number of tests to come to a conclusion whether he is having glaucoma or not. And once he is labeled as a glaucomatous, he has to be put on treatment, and this treatment remains lifelong. That one should remember. So this is the way how we diagnose a glaucoma. Now how it is managed? Simple way I'll tell you. Management of glaucoma is three types. One is the medical management, then comes your laser management and the surgical management. Medical management is the mainstay of glaucoma management, but unfortunately compliance comes into factor and disturbs this medical management. Before you are starting your medications, the patient or the person who is being treated should tell his doctor his comorbidities, whether he is having diabetes, hypertension, asthma, abdominal problem. That's one. Secondly, he should also tell some drugs which he is taking, because there may be interaction between the glaucoma drug. Some blood pressure drugs interact, some asthma drugs interact with glaucoma drug. Then he should tell his lifestyle so that we can adjust the dosage. Then he should also tell the socioeconomic condition of the patient, the availability of the drug. So all these factors have to be cohesively taken into consideration to come to a conclusion which medication is to be given and how much is your target intraocular patient to be brought down. So this is in brief the management of glaucoma. So this is, I hope I have shortly covered the importance of glaucoma and its management, but certain take-home messages I'll give you, friends. First and foremost, don't take any medication directly across the counter. Because in India, what we commonly see, even in place where I am staying at Sholapur, there is a lot of dusty climate and patients are having a lot of allergic conjunctivitis. And they go to the counter and pick up medications like steroids, and they go on putting, they feel fine, they are doing well. And unfortunately, the side effect of steroids is glaucoma and they lose their sight. So never take medications. Secondly, don't take your glasses directly through an optician by checking on their computers, because you may be missing a lot. Don't mind waiting for some time with the ophthalmologist, discussing the point and then taking the glasses. Thirdly, and the most important part, that if you are having a family history, have a frequent checkup, 6 monthly checkup or 1 monthly, or get all your relatives checked up if you are having a family history. Then at the age of 40, when you require that presbyopic corrections, use your ophthalmologist's opinion to take glasses and have a comprehensive examination. And lastly, don't be afraid about glaucoma. Glaucoma will result in irreversible blindness if you don't treat. But if you treat, follow your doctor's opinion, follow his advice, have a regular follow-up, glaucoma blindness will never encroach you and you'll be having a happy life, except for some few pennies which you are spending to put in the drops, or in the end stage you may require a surgery. But again, I'll tell you, you will still lead a good life. Thank you very much.